Hi, GROWCO. Today we're going to go through the anatomy and the reason why we like to do belly breathing for our moms postpartum. So we're going to go through the anatomy here. And we have a picture of the human body with a couple of layers of muscles still attached. So if we move the body, you can kind of see that underneath in this area, we can see the diaphragm, which is what the muscle that's responsible for breathing. And then if we look down into the pelvic cavity here, we can actually see the pelvic floor. So both of these are actually considered diaphragms. We consider the diaphragm attached to our lungs the thoracic diaphragm because that's the area of the spine that it is located. And our pelvic floor is the pelvic diaphragm. So these two muscles actually work together, meaning when one moves, the other is going to move. So for us to take a big breath in, we can do so two ways. One of the ways is our chest rises. That means the movement for breathing is coming from between the ribs, and the actual ribs are starting to flare out and upwards. Our goal is to take deep belly breaths, which would require the diaphragm here, or the thoracic diaphragm, to contract and slowly lower into your abdominal contents. That causes your tummy to rise. So that's why we refer to it as belly breathing, because when you take a deep breath in using your thoracic diaphragm, your belly is actually going to rise up. Now, the reason why it rises is because pressure is being transferred from your rib cage and your lungs downwards into your abdominal content. This also then causes downward pressure onto your pelvic floor. So if we look down into our pelvic floor, these muscles are going to have increased pressure when your big breath, belly breath happens. So you take that big breath in, we can feel our belly starting to rise, our thoracic diaphragm is lowering, and what we want to feel is that pressure on the pelvic floor, and we actually want the pelvic floor to relax. So that way, we are seeing downward movement of the thoracic diaphragm, and as well, downward movement of our pelvic diaphragm. This actually allows for both stretching of the pelvic floor, mobilization of the pelvic floor, and the contraction and the mobilization of your thoracic diaphragm, or the diaphragm that we usually just refer to as the diaphragm. So we have movement that's occurring together. So we can think of these two diaphragms almost like pistons, meaning that if your diaphragm here starts to lower down, that's going to put pressure on your lower diaphragm, your pelvic floor, and it's going to need to travel downwards as well. When your upper diaphragm from your lungs then relaxes, it starts to rise up, which then results in your pelvic floor rising up. So you want these two diaphragms to move together, downwards and upwards, downwards and upwards. So we want to keep this in mind when we're doing our deep belly breaths. And one of our GROWCO coaches is telling you to feel the pelvic floor relaxing and falling downwards. When they say this to you, that is what they mean. Hopefully this video helps explain why we need to do belly breathing in the postpartum period and how it is helpful in the recovery and the stretching of your pelvic floor muscles.